Hi, Danielle here. I've got Nick, my clinical mentor. She's going to be helping me with the ear exam today on Hunter. He's a 6-year-old golden retriever. So for his ears, he doesn't have any history of any infections, no excessive scratching, no debris or dark discharge. Okay, so I'm going to start with the hearing evaluation on Hunter. I'm just going to make a noise on either side of his head to see if he reacts. We'll try on the right side. Okay, looks like he's turning his head that way. Okay, perfect. So I'm just going to be doing the external ear exam. I'm going to start with his left ear. I'm just going to take a look at the area to make sure there's no hair loss, no swelling, no scratches. Lifting up his ear pinna. Looks really clean in here. There's no dark discharge. The color of his ear is nice. There's no foul smell coming from his left ear. I'm going to move to the right one. Stay. Just take a look at the area. I'm not seeing any scratches or hair loss on the right ear. There's no swelling. Taking a look inside his ear, it looks really clean. There's no dark debris or any earwax buildup. It also doesn't have a foul smell. Everything's looking clean in there. Okay, so the next part of the ear exam, I'm going to be doing an exam with the otoscope. So I just want to select the correct tip for my patient. I do want to make sure that I have a light source on my instrument as well. So I'm just going to lift up the pinna and gently insert the otoscope into the ear. Okay, so looking down the ear canal, it is pretty clean. I'm not seeing any dark debris buildup or no hair down into the canal. I could see the tympanic membrane. It did look kind of like a translucent piece of wax paper or almost like saran wrap, and there were vessels coming around the side of it as well. Okay, so I'm going to move to the right ear. I've got a clean ear tip. I'm going to gently lift up the ear pinna and gently put the otoscope into the ear canal. Okay, so looking down the ear canal, it was really clean as well. I'm not seeing any wax buildup or any dark debris down in the canal. I didn't see much hair down there either. For the tympanic membrane, it did look the same as the left ear, so some vessels coming around and kind of like a piece of wax paper as well. Okay, so after doing my external ear exam of Hunter, I'm using the otoscope. I don't believe that we do have to do an ear swab to check for any infection. We're also not going to do an ear pluck. So I am going to start with a simple clean. So I'm just going to take some gauze and I'm going to use some Udason ear cleansing solution to clean the ears. It is alcohol free. So I'm just going to place some onto the gauze. And I'm going to start with his right ear. I'm just going to lift up his ear pinna and start wiping away in the area that I can see in the ear. All right, I'm going to move to the left ear now and do the same thing. I'm going to gently lift up the ear pinna. looking at the state of his ears, we don't believe that we have to place any medication down into his ears either. And then if I did need to administer medication to his ear, I would just pull the ear pin up a bit, apply the drops, and then I would massage the base of the ear canal so it makes its way down the canal. Hi, Danielle here. I've got Deb, she's my CM. She's going to be helping me with the ear exam today. I also have Poppy. She's a 3-year-old domestic short hair tabby. So for the history for Poppy's ears, she doesn't have any history of any ear infections. She hasn't been scratching at her ears. There's no redness around her ears either. So I am going to be checking her hearing evaluation. So I'm just going to make a noise on either side of her head to see if she reacts. So I'm going to start with her right ear. Okay, and I'm going to check her left ear now. Okay, so I can see her ear is kind of twitching and moving when I make a noise. So I'm going to be looking at her external ear now. I'll just take a look at the area, see if there's any swelling, any redness. I don't see any scratches. Her ears look fairly clean. I'm not seeing very much wax or any colored discharge. I'm going to look at her left ear now. Same with her left ear. I'm not seeing any scratches, no swelling or redness. There's not much earwax or discharge coming out of her ear either. Around her ears, there's no hair loss, so everything's looking good there. Next, I'm going to do the otoscope exam. So I have my otoscope. I've picked out the tip that's going to fit down her ear canals. So when I'm using this, I just want to make sure that I have a light source on my otoscope. So starting with the exam, I'm just going to lift up her ear pinna, and I'm going to gently insert this into her ear. Okay, so looking down her ear canal, it looks good. It's fairly clean. I'm not seeing any redness or any buildup of debris or any earwax down there. Her eardrum kind of looks like a piece of wax paper kind of. I can see some vessels coming around it from the other sides. I'm going to now move to her left ear. That's okay. So moving to the left ear, I've just got a clean ear tip here, and I'm going to do the same that I did with the right ear. I'm just going to lift up the ear pinna and insert this gently into the ear. Alright, so looking down the ear canal, the left ear is also fairly clean down there. I'm not seeing any redness or swelling or any buildup of any debris or wax down there either. The eardrum, it looked the same as the right side, kind of like a translucent piece of wax paper. You can see some vessels coming around through the other side. For the next parts of the ear exam, she did have really clean ears, so my CM said it wasn't necessary to do an ear swab. We also don't need to pluck any hair out of her ears. Okay, so for the next portion, I'm going to be doing a simple clean. I'm just going to take some gauze, and the ear cleaner I'm using is the Ubisohn Veterinary Ear Cleanser. It is alcohol-free. So I'm just going to take the gauze and I'm going to just put some on here. And then for the left ear, I'm just going to lift up the pinna and I'm just going to wipe in the area that I can see. Okay, Okay, so her ears are very clean, so we're not seeing anything coming off onto the gauze. Next, I'm going to move to her right ear. Okay, and I'm just going to lift up her ear pinna and wipe away in an area that I can see. Okay, and in her right ear, also very clean. There's nothing really coming off on the gauze either. And for the medication, she does have really clean ears, so no need to put any medication into her ears either. Hi, Danielle here. I've got Nick, my clinical mentor, who's going to be helping me with the eye exam on Hunter today. Hunter is a 6-year-old golden retriever. So starting out with a history on his eyes, he doesn't have a history of any injury to his eyes, no eye infections. He's never had any medications placed into his eyes, and he's never had surgery on his eyes. I'm going to start out with the Menace response, so I'm just going to make a motion towards each of his eyes to see if he responds to that. So I'm going to start with his right eye. Okay, so we've got a blink from the right eye. I'm going to move to his left eye. Okay, so we've got some blinks coming from his left eye as well. Next, I'm going to move to the palpebral response. So I'm just going to kind of touch around his medial canthus to see if he reacts to that. I'm going to start with his right eye. Okay, so he's blinking with his right eye. I'm going to move to his left eye. Okay, so we've got reactions from that as well with his left eye. Okay, so for confirmation of structures, just taking a look at his eyes. I'm not seeing any hair loss around the area. There's no swelling. He doesn't have any discharge coming from his left or his right eye. There's no redness. Everything's looking good with his eyes. Okay, so I'm going to move to the pupillary response, direct and indirect light. So I'm going to be shining the light directly into his right eye to see if his pupil constricts. I'm also going to make sure that his left eye is also constricting. That's the indirect response. And then I'm going to do the same thing with his left eye. I'm going to shine the light directly into his left eye to see if it constricts, and I want to make sure that the right eye is indirectly doing the same thing. So I just want to make sure that I have a light source here. So I'm going to start with shining the light into his right eye. Okay, so his pupil is constricting, and the left eye is doing the exact same thing. I'm going to move to his left eye now with the light. Okay, so his left eye, the pupil constricts, and so does the right eye. Okay, so I'm going to move on to the ophthalmic exam of the retina. So I'm just going to start with his right eye. I'm going to shine the light into his eye. Okay, so looking into his eye, it's kind of like a bluey green color. I do see some vessels back there as well. I'm going to move over to the left eye now. Okay, it's kind of a bluey green yellow color, and I'm also seeing some vessels at the back of his eye as well. Okay, next we're going to be moving to the Schirmer tear test. So I've got tests for each of the eyes here. I'm going to start with the right eye. I'm just going to bend the tip of the test in the packaging. and I'm just going to place this directly into his eye, and we're going to let it sit for 1 minute. So I'm going to start with his right eye here. All right, so we've waited the minute and his test got past the 15, so he's in a good range there. Next, okay, so now we're going to move on to his left eye. So I'm just taking a clean sterile test here, and I'm just going to fold the test in the packaging. And I'm just going to place it into his left eye. Okay, and we're just going to wait 1 minute. After waiting that minute, we got past the 15, we got to about 19, so everything looks good there. Okay, next I'm just going to cleanse any discharge that may have built up while performing these tests. So I'm just going to take some clean gauze and wipe around the eye. I'm going to start with his left eye here. Okay, moving to the right eye. Yes. Okay, so next we're going to move to the fluorescein test. So I'm going to be staining his eyes with this fluorescein strip. And I'm just going to be applying some of this eye stream to the tip of this so that it drops into the eye. Okay, so I'm going to place a few drops into each eye.
Still.
Yes. Okay, I'm going to move to the left eye. Yes. Oops. Okay, so now I'm just going to crack the lights just so we can see the stain on his eyes. I'm also just going to make sure that I set this to the correct setting here. I just want to make sure that I have the blue light on so I can see the stain. Shining the light in his eyes, I'm not seeing any uptake of the stain. I'm not seeing any scratches or ulcers. I'm going to move to his left eye. Okay, his left eye also looks good. There's no any uptake of the stain. So now I'm going to do the nasal lacrimal duct patency. So I just want to make sure that the stain has moved through his lacrimal duct, down his nasal lacrimal duct, out of his nostril. So I'm just going to wait a few minutes to see if I can see the stain leaking out of his nose. Okay, so I'm going to shine the blue light into his nostrils to see if I can see any of the stain coming through. Okay, so I can see some of the stain starting to come through, shining out of his nostrils. Okay, next we're going to move on to the tonometry test. Okay, So I'm just going to take the tonometer out of the case here. I'm just going to turn it on and load it up. Okay, so I'm just taking a clean probe and I'm going to put it into the instrument. And I'm going to be starting with Hunter's left eye. I just want to hold this perpendicular to his head. I don't want to be too close or too far away, just so I have the correct reading. Okay, there are some things that can manipulate the reading of the eye pressure. So one thing could be having the head probably tilted up too high or too low. You kind of want the animal to be relaxed and looking forwards. And another thing could be putting too much pressure on the neck or the bottom of the head. That can also build pressure in the eyes as well. Okay, so the eye pressure on his left eye was 13. Okay, and the eye pressure on his left eye was 14. Okay, so I've got a clean probe here. I'm just going to load it into my tonometer. And I'm going to move to his right eye. Okay, so the reading for his right eye was 22. Okay, and for the final portion of my eye exam, I'm just going to instill some drops into Hunter's eyes. So what I'm going to be installing is just some Isopto tears. I'm going to start with his right eye. So when we're applying drops, I just want to make sure his head is a little bit elevated. I just want to move his eyelids away from the area, just to make the surface area bigger. And I don't want to touch the bottle to his eyes because it can cause injury. So I'm just going to hold it just above his eyes and make sure that I get one drop in there. And I'm just going to kind of move it around. And same thing for the left eye.